Bueno, buenas tardes. Mi nombre es Sebastián Mendieta y mi grupo está conformado por Dani Santiago Lozano y Daniel Escobar. Y hoy les venimos a hablar sobre biosecurity o radiology. Radiological protection objectives 1. It is to protect human being from the harmful effects of radiation. The second object, prevent the action of deterministic biological effects in the body. The object, limit the possibility of occurrence of the off-site effects. The fourth object, establish the limits low enough so that the threshold that is not reached not only during the work period but also throughout the person's lifespan. Five object, keep exposures as low as reasonably possible in any case below established limits. Occupational exposed workers. Category A, people who do the condition in which their works is carried out can receive an effective that's greater than 6 NCG per year. These works are required to wear a dosimeter. Category B, does exposed workers who are not classified as exposed workers. Radio protection in radiodiagnostic. Radiodiagnostic is the leading cause of artificial irradiation in the population. 1. Make rational use of radiology and rigorously apply the justification criteria for examination and optimization for exposures to patients. The second is reduce the dose without loss of diagnostic information. Standards for the protection of patients. 1. About the unnecessary radiological examination. Ideally, there is a close relationship between the prescribed physician and the radiologists. We are able to decide the radiological management of a patient or is search of a diagnostic. Second, have previous studies. They are the key to a diagnostic without the need for another study or allow use to substitute the request test for another alternative that does not irradiate the patient. 3. About this moment of the patient, main cause of repetition of students, incorporate children a patient. 4th, position centering and patient neck. Check that this adequate to minimize the number of repetitions. If we reduce protect more milliamps per second, we achieve a double objective, reduce the freezing time at the DAS. 5. Use the collimators. Reduce the radiation field to the air we intend to study. It's an easy way to limit your radiation dose. 6. Reduce spores minimization compatible with obtained diagnostic information. 7. When conducting examination that involve a long series of radiograms, it is convenient to expose one conventional with chemical development that has been carried out under the appropriate condition and subsequently perform the rest of the series. 8. Ask each woman of a childbearing age if she is or could be pregnant. Sync in each X-ray room will warn the pregnant woman to notify the staff caring for her. 9. No patient for family members should wait in the X-ray room. When conducting examination that involve a long series of radiographs in the convention to expose one conventional with chemical development that has been carried out under the appropriate condition and subsequently form the rest of the series. 10. Put on an apron. In dental radiology, the patient must put on a protective apron 11. Carrying for the chassis, backing checks and developing apparatus. Improve use, image qualify, reduce repetition and decrease in radiation dust. Rules intended for the protection of professional exposed personnel. One, use of the lead protection, use of the lead apron and the D-road protection in interventional radiology and in those exploration that require the radiodiagnostic to stay in the X-ray room. Avoid pouring your hands in the radiation field. Use the apron, the road protector, and the lead gloves when it is necessary to stay in the X-ray room and when carrying out portable students. In the later case, the technical will stay as for anyway from the equipment. Second, unprotected personnel will be prevented from staying in the room, encouraging out X-ray with portable equipment. 3. It will be begin the leaded screen during the mammograms. 4. Keep the door of the room closed at the time of shooting. Room should have a light signal when radiation is emitted. 5. Publicize the radio protection standards to all professionally exposed personnel, especially in equipment operators. 6. Limit the portable students in the operating rooms to the strictly necessary case. The operator will never be apprehended at work. The X-ray tube should never be pointed directly at the window.
Situations of the pregnant. As soon as a pregnant woman communicates her status to the company, the protection of the fetus will be compared to the health of members of the public. Therefore, the working conditions of the pregnant woman will be such that the equivalent dose to the fetus is as low as is reasonably possible. 1. In no case may the dismissal or terminate of an spouse worker due to pregnancy occur. 2. In no case exclude the forced transfer of a pregnant woman from her home in radiology to another service of the clinic or to different health institutions be accepted. 3. The fact of being pregnant is not incompatible with professional work in a radiology service of or incapacitated to carry out activities corresponding to the professional category that do not involve sport. 4. Pregnancy is not a reason for sick leave only when during the gestation period some eventuality are stated. 5. Pregnant workers will have the right to be absent from work to carry out pregnancy exam and preparation technique for childbirth. 6. As for the medical wards, the legislation does not release the pregnant woman from this obligation as long as the pregnancy runs its course. Those limitations. The dose received might not exceed the limits established by legislation even in more exposed individuals. For exposed workers, the 32 limit will be 100 ms for a period of 5 consecutive years, subject to a maximum effective dose of 50 ms in any on year. For members of the public, the effective dose limit will be 1 ms per year. A higher effective dose value might be allowed in single year. For students, the dose limit for students of the 18 years of are work during their study are obliged Two sources will be same as that for sport workers. Special protection during pregnancy. Those limit on medical sports. If exposure is justified and protection optimization, the dose the patient receives will be as low as reasonably possible to achieve the diagnosis of therapeutic purpose. Biosecurity standards for the area of immunology. It is mandatory but considered that it affects the employee directly involved, his co-workers, patients and the community in general. It must have sufficient light and ventilation space necessary for the transit of patients and the professionals in charge of taking place. The service must have athletes on sink in good condition, including the availability of cold water, leaky soap, and disposable towels. The technician in charge of this service and its air assistance, if any, will wash their hands before and after caring for each patient. Eating, drinking, smoking, or applying cosmetic is prohibited in the plate taking and reading area. This area must use
Officially in their area must use the later approach to take place even if the operation is behind the screen if the radiologist, the technician, or one of their assistants has abrasion burning, laceration, dermatitis on the hands or arms, the affected part must be quick, covered with terrible material to avoid contact with fluid body tissues on a time from the side or patient until the wound has fully healed. Heal working were in a state of pregnancy mode exception. Biosecurity precaution. The disinfectation on the floor walls, surface, objects, machine, equipment, furniture, curtain, sheet, cover, and in general and the instrument use require and seldom running on clean and remove height. Each time they may come into contact with the patient will by cleaning behind patient using disinfectant agent. The use of personal protection elements, gloves, use your face on around easy addition to the implementation of method for controlling biological risk factors, clothing and personal protection in time must be removed before having the water, especially if you are about to enter the RSR for where the risk can spread to the unisport population. The accidental result in working exposure to infection material, fall, flood, again dislocation. There must be reported immediately and as they constituted a work accident, meaning is required to transfer a patient from the emergency service or hospitalization to take place, and the personal protection element must be present and changed will entering the radiology service avoiding cross contamination